Right, this video here, we're going to look at the palpations for the foot and ankle that you'll have on your practical. So it's in your lab packet for ankle foot. Any of the palpations or other measurements in there are available to be asked of you on the practical. So getting into this here, let's go starting right at that ankle joint here, looking at the medial and lateral malleolus. So on this lateral side, obviously, is where you're going to have that lateral malleolus. It's going to be a crucial landmark for the axis of the goniometer for plantar flexion and dorsiflexion, plus a good spot to palpate some muscles. We'll work on that when we do MMT. On the medial side, you have that medial malleolus here, and that's part of the tibia that comes down. So the tibia and fibula both cover the talus. So if you come back over here, that talus is going to be, you can kind of dig down in there, and that soft spot between those two and kind of get down in there. It's kind of buried between, so it's a little harder to get to. So you kind of got to be gentle, work your way in. You got the calcaneus in the back, your heel. Shouldn't be missing that at all. Now let's stay with this lateral side here. If you follow the fifth metatarsal down, you'll eventually find the tuberosity. It's a pretty obvious bump. Don't push real hard because it's uncomfortable. And then as soon as you drop off there, that bone back behind it is going to be your cuboid. So then let's switch over to the medial side. So you're going to follow that first. So we're going to find the navicular of the tubercle, or the tubercle of the navicular right here, and then keep going back a little bit more, and you're going to find that navicular bone. There you go. You can feel that tubercle right there really good. And then in front of that are your cuneiforms. So that medial cuneiform could be on the practical, and then the tubercle of the navicular bone right here on that medial side. Then we have the MTP joint, the first one. So this is going to be right here, your big toe. And then your interphalangeal joint here. So either one of those could be on the practical. Then you have the MTP joint for 2nd, 3, 4, and 5. And then you should be able to go between the PIP and the DIP of those guys. Make sure you can find those. And we'll practice that more in lab as well, and practice on yourself. You just got to kind of get a feel for it. So the more people you can palpate, the better. So that's there with the foot and the ankle, but we got one more that's far away, but we need to do this one because it's part of our palpations for lining up the goni. So we're going to follow the lateral malleolus up the side of the leg to find the head of the fibula. So some people have it pretty prominent, other people you might have to look for it a little bit. But we'll be lining that proximal arm up of the goni with the head of the fibula. A common mistake that people make is that they palpate the tibia all the way up here. This is the tibial plateau. So the head of the fibula is going to be back and down a little bit compared to the head of that, or the plateau of that tibia. So it's going to be your mark there. And those are the palpations you need to know for the practical.